There are definitely differences with what we focus on with nutrition during treatment compared to after treatment. So when a patient is facing treatment and they're undergoing that treatment, their body's requirements are actually a lot higher for energy, so that's calories, and also higher for protein. So we tend to focus a lot on getting extra energy and extra protein in during the therapy. And if we can do that, that means people are more likely to be able to maintain their weight and also keep their immune function up as well. So preventing, any of those extra illnesses and coughs and colds, and keeping their cell counts up higher. When patients are towards the end of their treatment and have finished treatment, we know that for some period of time after therapy, their body is going to remain in that hypermetabolic state. So that really means that their the metabolism is turning over faster. They're going to be needing that extra energy and protein. But after a period of time, that will slow down and their body's metabolic rate will turn to normal, much like a person who is not undergoing cancer treatment. So in that time, we do need to make a transition. So some of our nutritional messages will change. We've been focusing a lot on energy and protein and getting enough calories, and to do that we often need to add in extra fats to the diet. So people on treatment can tend to be having a diet that is not what's recommended for a general healthy person. So it'll be calorie dense, so there might be lots of fats, extra sugars, nutritional supplement drinks to meet those calorie demands and protein demands. And then after treatment, we're going to be trying to transition back to a more healthy pattern of eating. Following healthy diet recommendations, getting just enough energy to maintain a healthy weight, preventing further weight gain, bringing people back into a more healthy weight range, we know that that's really important for long-term health, preventing chronic diseases and so forth. We will try and do that with patients when they're in that survivorship phase. We also want to be focusing on the types of foods as well. So we know that young people after treatment have very similar diet patterns to people that never had treatment. So we know that probably close to about 80% of our young patients will be eating diets too high in sugar, okay? And also the majority of patients are not getting enough fruit and vegetables. So dietitians will be working with patients in that survivorship phase to try and get those healthy diet messages to the patient, so that we can be preventing, new diseases, new cancers, new conditions that, will have severe and, significant consequences for later on in life.